Well, there's no doubt weight loss meds, they're a game changer, right? Some are even calling them a cultural phenomenon. So many people are asking, they're taking these drugs like Zepbound and Wegovy. They've helped a lot of people. So this morning, we want to break down what these medications do, who may benefit, the risks we should all know about. Joining us, we have Dr. Marsha Blount with Sharp Rees-Stealy Medical Group. Doctor, great to see you. Thank you for coming to talk about these drugs that so many people, I'm sure, are asking you about. Let's start off with the basics. Tell us how these drugs work.
That is a great question, and probably the most important thing that I could talk about today. The short answer is they make you less hungry.
Okay.
They decrease the hunger hormone ghrelin. And why that's important is there was a study that came out that showed that people who struggle with weight, that they had too much hunger hormone, too much ghrelin compared to baseline.
Okay.
And that was really important, game-changing information, because when we realized that, we realized the discrepancy between people who struggle with weight and don't. And that's when we realized we have these meds that can take that hunger hormone from too high back to normal. When you have too much hunger hormone, it will drive you subconsciously to eat more than you need to survive, and that's where weight comes from. And when we use the meds and we correct that part that's broken, get the hunger hormone back to normal, then we find that people are less hungry, they eat less, and when you eat less, you lose weight. And it's important to understand that these meds are not a crutch. There's so much stigma around weight and
right,
so
many
shame.
people say that.
Right,
yeah.
exactly. But the fact that it's fixing something that's broken, that's what's important.
Okay, and so many people have said it shuts off the noise. That's what I hear from people all the time.
Yep.
And that noise is that ghrelin, like you were talking about.
Exactly.
Okay, that's where that comes from.
Yes.
I see. When people stop the medications, of course, there's that concern of gaining weight back.
Absolutely.
What have you seen? What do you suggest? Why take them?
So that's kind of a thing that people are like, well, when you just stop the medicine, you gain the weight back. Well, it's true, but I like to give the information behind it. So the med works by fixing something that's broken. The hunger hormone's too high, so you fix it with the meds, and they're able to maintain their weight loss on the meds. If you stop the meds, about 80% of people will regain their weight back within 2 years, but it's not the fault of the medicine. It's because you took the fix away. And this is also where the stigma comes along, where people stigmatize people with weight, but no one complains about if they have high blood pressure. If I took their high blood pressure away, what would happen? Their blood pressure would go up. So it's not surprising that there are many meds within medicine that work by fixing a problem. If you took the fix away, the medicine away, be it for blood pressure or weight or multiple sclerosis, the problem would come back. So.
Okay, so does that mean people would take them longer? Is that what you would suggest?
We do consider them long-term meds for most people, and you want to look at it this way. You're going to deal with something long-term. If you keep the weight long-term, you're going to have more medical problems long-term, feel worse long-term, have more medicines long-term to deal with those problems that come from weight, be it blood pressure, diabetes, cholesterol, joint issues, versus lose the weight and keep it off long-term, have fewer problems long-term, have fewer medicines long-term, even if you need the weight loss medicine long-term. Okay. So it's an easy decision for us.
And in your practice, let us know what you've seen as far as the amount of weight people have lost. I mean, it seems pretty impressive, some of the stories that we hear, but what do you see? Yeah.
And I like to say I went into medicine to help people, but I can give blood pressure, cholesterol, and diabetes medicines all day long. I'd rather not. I'd rather you not need those medicines and help you be healthier. So the average weight loss that we see is about 5 to 10 pounds a month until you plateau. Now, not everybody loses weight. We do have what we call non-responders, and we haven't figured out why those people don't lose weight. But the other good news is, in addition to the meds that everybody knows about, the Wegovy and the Zepbound, there are several other meds. There are 4 generic pill meds that have been around for 30 to 40 years that are inexpensive, that can be as effective as the injections. Best thing to do is talk to your doctor about all the options you have, because there are many options to try. In case one doesn't work, we could try another.
I know we only have about 20 seconds here. Real quick, the side effects. What are some of the common ones?
Most common side effects, nausea, constipation, but these are things that we can help with. And each medicine has its own specific possible side effect, but that again is where your doctor can help you. If you notice anything, let them know they can help.
Okay, and obviously ask your doctors for the advice on this, and obviously the cost, that's another part of it all.
Yep.
I know more to talk about. Thank you very much for joining us.